Postinor 0.75 mg tablet. The Postinor box contained 2 tablets. Postinor tablets contain the active ingredient, Levonorgestrel. Belongs to the class of emergency contraceptives. Used as systemic contraceptives. How to use Levonorgestrel. Levonorgestrel is used as emergency contraception to prevent pregnancy after unprotected sex or incorrect use of birth control, for example missing your routine oral contraceptive doses, or slipping, breaking of the condom upon use, or having sex without using any birth control method. Note: this medication is not to be used on a routine basis and is usually given as a backup method. Do not take Levonorgestrel if you are allergic to Levonorgestrel. If you are pregnant, this medication will not stop pregnancy if you are already pregnant. For regular birth control. Side effects of Postinor tablets. Possible side effects of Levonorgestrel include irregular or heavier menstrual periods, lower abdominal pain, nausea, headache, dizziness, and fatigue. How to take Levonorgestrel. Women 17 years and older. Recommended dose is, if you are using 1.5 mg tablet box has 1 tablet only, 1 tablet orally once within 72 hours. After unprotected sex. If you are using the 0.75 mg tablets box has 2 tablets. Make sure to take 1 tablet followed by the second tablet after 12 hours of taking the first. Both tablets should be given within a 72-hour period after unprotected sex. Note: if you vomit within 2 hours of taking a dose, make sure to contact your doctor to check if you have to take another replacement dose.